Thanks for staying with us. So this next segment is a conversation starter, obviously, because we can't finish this conversation. But we ran into a message on Instagram, and it's kind of trending right now, and I thought it was something that was important to talk about because it's health-related. This report that we saw, and I think I picked it up from Kennedy Bankole's page, was talking about somebody else's experience, where they saw a man in blood on the floor, and obviously he had an accident. He had blood all over him. From, I think, Unikpanu, just close by here. And what happened was that they stopped to call, they called the emergency numbers. They kept saying they would come, but they never showed up until the time this person saw it. It was about an hour, over an hour. The ambulance didn't come, so the person offered to carry this person to the hospital, and it was LUTH they took the person to. They got there, obviously, they said they couldn't treat him, they should carry him elsewhere because they couldn't take him, an accident patient. Eventually, they got, they were willing to take him in. I'm trying to get the details of the story right now.
LUTH said there were no available beds, and they can't admit him there, so they gave a referral to LUTH. That's a federal hospital now, and the person then took that patient to LUTH at 1 a.m. at night. And then the doctor examined the person and said they cannot treat the person, you know, and walked back. And so there was now
there was no bed. Remember, they had to treat him in the car.
No, there was now an argument, and the police said, treat him in the car, at least administer first aid.
Yes, I wanted to also add that
and then
they
because
had police escorts.
They found the police around the incident, the accident point, and, you know, he accompanied them to these hospitals. And then when they finally got to LUTH, they refused to treat, and they got to argument, and they said, treat in the car. And then the doctor came out and said, they're quoting him and said, the law here states that no patient should be attended to that is not in bed. This is a person bleeding and possibly hemorrhaging. And, you know, the medical person on ground is saying, I won't even touch because there's no bed.
They also asked consistently for at least first aid to be administered, and that was also refused.
Now, the reason why this is so important is because we keep seeing these stories. I have experienced something like this, exactly like this before in the past, and I've said this on the show before. And it's like there's no end to this, where we have we need emergency services. I know the state government have put measures in place where they have 121 numbers, but for whatever reason, they were unable to provide help to this person. That's on one hand. Then the hospital, both federal, one federal, one Lagos State hospital, the other is federal, both couldn't help this man. The person who helped him said, you know what, when I drop you, I don't want to holler because you're going to die in my hands. It's the same thing that happened to me many years ago. So how are we going to solve this problem of first aid or saving lives
sorry to,
in this kind of situation?
You again. So this person who assisted a wounded person now was made to go through trauma himself, because now he's thinking, you're not helping him, and I cannot continue to carry him around in my car. Let's leave him at the hospital. And then they said, lock the gates. He must not drive out without this person.
So I don't know how we solve this kind of problem, because it's one thing to say we the people, because really it's we the people. Because if you speak to the government officials, they'll tell you that they first of all removed that law that says that you don't attend to accident victims. That the police, you don't need the police report. They'll tell you they've changed the laws, right, on our behalf. So we the people should be able to see an injured citizen and say, you know what, let me help you first. And then we'll talk about documentation. Right now, this person there was no bed. That's also an issue with the government, because there was not enough bed. They couldn't treat this person. Who do we therefore blame in this situation?
So the obvious, Nima and I are customers of public hospitals, general hospitals. So I can say for a fact that we do not have enough facilities to take care of citizens of Lagos. And I know that a lot has been done. I must acknowledge that a lot has been done, but the kind of facilities that we need, the capacity of facilities that we need, we are nowhere near. So there is no day that there is enough beds in our general hospitals and teaching hospitals, except for primary healthcare centers. General hospitals, it is a perpetual thing. Any day you get there, they are going to wait for one patient to be transferred or something. It's not like there's no bed. So that's one. Number two is the attitude of the workers, the lack of compassion, the frustration of the work, the coming to mark register.
Let me take this call, our guest actually, Dr. Yemi Oshinaike. He's the head of accidents and emergency, who personally took charge of this case. Good morning, sir. Are you there?
Good morning.
We're so glad to have you. Please give us some clarity on what took place concerning the story we just shared.
Okay. Thank you very much.
Leave the volume increased, please.
It's always a difficult moment when you have to be faced with a situation where immediate care couldn't be administered to a disabled citizen of the country such as us, and I do sympathize deeply with the person in question. And I'm just going to give you a little backdrop to the referral system, and then I'll talk about this case in point. And you described largely what exactly happened preceding referral to LUTH. This was someone who was picked up and possibly, we're not sure, circumstances surrounding his injury, and was sent first to LUTH, which is the tertiary equivalent of LUTH in Lagos State. And for reasons stated, lack of bed space, it couldn't be attended to. And then a referral letter was sent to LUTH. Now, what I want you to first appreciate is what really should have taken place. This was a situation where wherever the person got to the initially, which was at the Shomolu Healthcare Center, whatever little form of the cleaning or whatever it is that they think should be done could have been done, and the critical issues attended to. And when it got to last week as well, they should have evaluated, decided what the critical issues, and I want to assume they did that, and then before you refer from one end to another end and write a letter, sending a patient out with a note is not referral, and it doesn't constitute adequate first care or first aid treatment for the patient. And so the patient had a note written to LUTH. A confirmation wasn't made by LUTH to LUTH to ask, can you take on this patient? Which unfortunately is the pattern we see with referrals that come from various places to the other end, where patients are sent daytime, nighttime, at odd hours of the day, without appropriately confirming the availability or otherwise of the capacity of the referring end to retain and to take on the patient. As the patient got to us at 1 a.m. Thereabouts, an initial evaluation was done to evaluate what the critical issues were. If you come to LUTH, and I invite you to come at any point in time, we do what we refer to as a triaging system. A triaging system basically is evaluating the patient to determine what are the critical issues in this patient, what are the immediate level of care this patient requires, and if the care needs to be escalated, to what extent should this care be escalated. This was done for this patient, and we deemed that, look, the critical issues in this patient at that point in time were not one that if the patient had to wait an extra hour to get a bed.
All right. Okay. Fair. Oh, sugar. We have to get that call back.
I hear you. I know the procedure.
He was giving ideal circumstances.
He's giving an ideal circumstance. So starting from Shomolu, someone should have at least done what they call first aid. No, there's what they use. I wanted to use the medical word they used to call it.
Preliminary check.
No, stability kind of
stabilizing.
To stabilizing. And then that was not done. For no fault of the patient or the rescuer, they had to go to another hospital. And then another thing wasn't done. At LUTH, last where they went, they were even just giving a note, which was not enough to be a referral for LUTH to take him on. We're talking about a patient here, and you're talking about
bureaucracy and the procedures.
So, no, but the bureaucracy is right. He's saying that before you refer, that he's saying that what they did was wrong. There should have been a referral based on a phone call to LUTH to confirm that they have bed space and ability to take LUTH. I have been in General Hospital Pediatric Center at around 12 midnight with a baby, with my child that was barely breathing well. Because I had made phone calls ahead, there was ability to get him treated. But I saw a premature baby that was brought in from a private hospital, tiny, I've not seen a baby that tiny before, tiny baby wrapped in cloth, to the LUTH hospital to get into the incubator. And they said, oh, our incubators are full. Go to Island Maternity. And the woman is like, see, we need to do something. I don't want my baby to die. So it was supposed to go with a car. The procedures are not being followed through. Okay. And a lot of people will lose lots of avoidable lives to these medical negligence.
We have to wrap. You see, this thing,
let me just tell you the end goal of the doctors when they do this. The person
they don't blame them.
Die.
Yeah.
They will say the person is going to die.
So
he should not die in my hand.
Because they don't ever see the end. We carried somebody, starting from Amu Odofin to Navy Hospital, from Navy Hospital to Lassos, then to LUTH, and then we started going to Shagamu Hospital. How is it possible? That man died the next day.
Nima.
This is my own neighbor.
Nima.
My husband returned from work at 8, and he didn't get back home at 5 a.m.
You see, the reason why this is so personal, because I have been through this phase where I saw a 14-year-old pregnant girl, the baby was out, flies all over on the floor.
I remember your story.
I picked that girl up to the hospital. We said, Maria, you can't take her without the police. We have to go and look for police. Please, come on, carry her first to the police station. Put police station in my car. Took her to the hospital, said, so we can't take her in. Take her back to where we found her. I live with the regret that I had to take that 14-year-old girl back to where I found her. So tomorrow I still see that girl's face, and I pray to God she did not die. I don't know what happened, because I had to just drop her back, and I just took her back there. That is the Nigerian story.
That is the Nigerian story. You know what? We've also always heard about that police report. Your case, you had a police officer. This case had a police officer.
Yet,
I don't know. See, hospitals, you people need to look at yourselves and tell yourselves the truth. This is no longer about bureaucracy or police.
Do this kind of
things. It is about humanity and empathy. I don't get it. You see someone covered in blood, about to die, and you can step in and do one or two things.
Say there's no bed space.
You have a medical expert.
Even in countries where they have everything, we see what they do at the site of where
reception.
We see what they do in the car. We see what they do anywhere that they can to give immediate emergency intervention. I don't understand how we're able to even make a call and try and explain and explain and explain. And all I've heard now is just the bureaucracy. What should have been done? What should have been done? When you were there, what did you do? And that's our Nigerian mentality. What everyone else should have done. And yes, not about me.
I got back. I was on your view already. I got back and saw my neighbor bleeding through the nose. I did not know it was possible from BP. I didn't have that knowledge. I took her to my own private hospital. We sorted out the bill between myself and my husband. But when I got back and they said the BP was exceedingly high, and all my neighbors blamed me. Did you know for 2 weeks I felt stupid?
Okay, we have to run. That's what we can take. As I said, this segment was a conversation starter. We can't finish this conversation. Have a great day. We'll see you tomorrow. Bye for now.